Wonderful people, welcome to my channel. Today's discussion will be the continuation of stroke. If you've not watched that of part 1, you can pause the video here and start from there. Let's continue. Sometimes first attack of stroke symptoms can just disappear less than 24 hours. We call it mini stroke or transient ischemic stroke. I hope you still remember the symptoms of stroke, where half of your face will be drooping, you will have weakness in your arms, being difficult to raise both at the same time, you will be coming with unclear speech, and at that moment there is no time, you have to rush to see a doctor immediately. The same appears to the first attack. The first attack too, although it can disappear less than 24 hours, but still you need to see a doctor immediately. If you fail to see a doctor, as time goes on, later there will be other episodes or the full stroke. The first attack wasn't a full stroke, it was like half stroke. But if you didn't see a doctor for management and medications, there will be future major stroke occurring, which will come with disabilities. So when you see the first attack, you rush to the hospital and you report it for them to make investigations and put you on medications to prevent future occurring of the major stroke. And there are people who are of high risk of stroke. That is people having high blood pressure, that is hypertension, as I said earlier on, people with diabetes, people having sugar disease, they are of high risk, because those hypertension and sugar disease, they can be depositing on blood vessel, yes, and becoming hardened. The excess sugar will deposit with the protein and make it hard, and it can cause rupturing of your blood vessel. So as the blood also uncontrolled of it can cause rupturing, or it can be depositing, causing blockage and preventing blood circulation to your brain, which will then cause stroke. So that two condition can cause stroke, and if you are in that condition, you have high risk, so take note. And in case you are obese, you are of high risk, the kind of lifestyle you live, if you live on healthy lifestyle, you are of high risk. If you smoke, you are of high risk. If you take much alcohol, you are of high risk. So take note of all this. Let's talk about how you can prevent stroke. In terms of preventing stroke, all the conditions I mentioned, if you are a hypertensive or you have high blood pressure, you need to control it. Take your medications very well. And if you are having sugar disease or diabetic, that one to make sure you manage it well to prevent progression causing stroke. And when you get to the hospital, you can even request the doctor to check your lipid level. Like, you have to manage your cholesterol so that one won't build up as fat and become hard or plaque and cause interruption of blood circulation. You have to make sure you do exercise so that your blood will circulate well through your whole body. Do more exercise and eat healthy food. Don't be eating those unhealthy saturated fat food. No, you have to take them off your menu and eat healthy meal. Talk about how to recover from effects of stroke. Supposing you being stroke patient, unfortunately for you, you weren't able to notice the symptoms early and it has led to disabilities. As I said earlier on, in case you don't respond early to the symptoms, it can cause disability, or your hearing can come out with how you responded to the symptoms of stroke. So I can assure you, you can recover. Even if you are battling with some disabilities, you can recover, but just that it will take time. Yes, slow or bit by bit, you'll be recovering. So take your medications, You can also invite rehabilitation center services, like supposing you are battling with swallowing, you have disability in terms of swallowing, you can invite dietitians to assist you. They will help you, teach you how to start even swallowing again, the kind of food you should start taking, and bit by bit you can take whatever you wish to eat. And in case you have challenges in terms of movements, you can also invite physiotherapists. They will assist you, they will guide you, train you, and you can make your normal movements once again. In case you are battling with memory, you can invite psychologists depending on the part of your brain being affected and the results or the challenges you are facing now. If you can't recognize or remember anything again, you can call those psychologists. They can also help you. They can pass you through counseling. They can help you through motivations, assurance, whatever that they can do in their part to help you. You can recover. If you are facing challenges in speaking, you can also invite those language therapists. They will also help you with their own services. They can help you, and at the end you can speak as you used to speak. And overall, we all believe in miracles, so we know God still exists and He's still doing signs and wonders, and we are rest assured you will bounce back strong. But remember, the best thing every day you have to do is you have to be fast. Go and see the doctor immediately to prevent any permanent disabilities. Thanks for watching. Share, like, comment, subscribe. Any question you can ask at the comment section, and subscribe to my YouTube channel.